Next, we'll be talking about water safety with the children that you will care for. You must obtain prior written permission from your parents for the children to participate in water play and swimming activities. Keep small pools empty when not in use, and clean and disinfect them before and after each use or when dirtied. Look at the picture below. Notice the sagging in the blue pool. Children can get caught and suffocate in the sides of this pool. These types of pools are not recommended for use. During water play, be physically present at the site and provide constant and direct supervision of children. A caregiver shall make sure that children that are involved in swimming are supervised by an adult swimmer. A second adult swimmer is required when more than 3 children are swimming in a pool more than 24 inches deep, or some children are swimming and some others are not. A second adult swimmer is also needed if some are in a baby pool and others are in a regular pool. When you're swimming in areas outside of the home, you need to obtain permission from parents. You must also supervise children at all times and ensure that the lifeguards are present. If you're using a fence manufactured strictly for above-ground pools, it should extend at least 2 feet above the pool and have a locking ladder attached. If the pool is above ground, the fence must be at least 2 feet higher than the top of the pool. Enclose all swimming pools deeper than 24 inches with a fence at least 4 feet high. If you have a hot tub, you need to equip this with a hard cover. Children are not allowed to use hot tubs. Emergency practices in your family childcare home. You must post emergency phone numbers. The numbers listed here are the ones that are required. The emergency list must be easily viewed by both provider and children. There will be a list in your second packet. If you fill in the blanks and post the list, you will meet this requirement. Complete, notarized emergency information and parental permission forms for emergency treatment shall be obtained prior to a child's placement in the home. Each child must have a separate form. Notary services are available at your local resource and referral agency, the local library, or the West Virginia DHHR office. If any part of the form requires changes, a new form must be completed. It cannot be changed once it's been notarized. Emergency consent forms will be provided in your second packet. The following supplies in this list need to be available in a portable container out of children's reach in a first aid kit. These things include a digital thermometer, sealed packages of alcohol wipes or antiseptic, disposable gloves, blunt tip scissors, tweezers, soap, first aid guide, bandage tape, and sterile gauze. If you do not have a prepackaged first aid kit, you may place the items listed in any portable storage container. Make sure it stays stocked by checking the inventory regularly. We will now discuss safety procedures if you plan to transport children in your care. When transporting children, the caregiver must notify the parents in advance when the activities are planned that require the transportation. You must take the children's emergency consent forms in the vehicle in case of an accident or an illness. The caregiver must accompany children on activities that require transportation. You must ensure that the driver that is transporting the children has a valid driver's license. And ensure that the vehicle that is used to transport children is in safe, running condition with insurance and a current inspection sticker for West Virginia. A first aid kit must also be taken with you during transportation. You should include fresh bottled water for the kit when transporting children. If you transport children, please have your auto insurance, registration, and driver's license available during inspections by your West Virginia DHHR regulatory specialist. This is the law regarding child safety during transportation. Children who are not 8 years old or 4 foot 9 inches need to be in a child safety seat. Child safety seats have their own weight and height recommendations. Be sure you are using the proper one for each child. Children must not share seatbelts. This section will talk about the program and equipment needed for children in your care. While operating your family child care home, you must post a daily routine. The items in the routine must be appropriate to the ages in the children in your care, and including specific meal times, nap time for children who need them, as well as time for indoor play. The schedule must include outdoor play time on days when temperatures are 40 degrees or above. The routine must include a balance of active and quiet play, and include time to learn skills like hand washing, teeth brushing, dressing, and toiletry. A family child care home must implement a program that enhances the healthy growth and development of children. To do this, please encourage and teach children about exercise, hygiene, and social skills like sharing, getting along with others, manners, and communication. Your program must also ensure that age-appropriate books are read on a daily basis to children between 6 months and 5 years. Your program must have appropriate indoor and outdoor toys, materials to support the daily activities to keep children entertained and learning. These materials can include arts and crafts, music, games, puzzles, books, building blocks, dress-up clothes for dramatic play, balls, riding toys, manipulative toys, large muscle equipment, and science materials. We will now discuss guidance and discipline techniques that can be used with the children in your care. You really need to discuss with the parents and agree upon positive methods of guidance that encourage a child's acceptable behavior. As the caregiver, you must use guidance that help the children understand appropriate behavior and is appropriate for their ages. A family child care home must have rules that are fair, consistent, and relevant to the child's age. You should use redirection as the initial form of guidance when it's possible. Timeouts shall last no more than 1 minute for each year of a child's age, and should only be used for the purpose of helping a child regain control. A caregiver, household member, or a substitute caregiver may not use any harmful forms of discipline. Please read this list to understand what is defined as harmful forms of discipline in this environment. A caregiver may not also punish a child psychologically. This includes public or private humiliation, shaming, negative remarks about the child or the child's family. A caregiver must not punish a child emotionally by rejecting them, terrorizing, ignoring, or isolating them. A caregiver may not allow other children discipline a child. A caregiver may not seek or accept parental permission to use any punishments or acts prohibited in this rule. That means even if a parent says it's okay, you still are not allowed to use this form of discipline.